Hey folks, we're going to do a quick video on this heart model right here. So starting with some very basic stuff about this heart, about this blood pump. Here is the apex of the heart. If we spin it around, we've got the base. Now on this base, I do see one of my atria right here. This is my left atrium. Over here, I've got my right atrium. So I got my right atrium right here. I still see the left atrium. There it is, right there. You see this nice, lovely diagonal line right there. That separates your lower chambers. Got my right ventricle on that side. Got my left ventricle on that side. So those are the four chambers of my heart. 2 atria for receiving blood, 2 ventricles for pumping blood. And of course, remember we got 2 circuits of blood, 2 types of blood. That's why we have 2 of each. All right, as far as the layers of the heart go, when we look at the outside, this outer layer, no matter where we are, is the epicardium. If I rip off my anterior ventricular wall here, I can see the inside. So anything on the inside, any part of the inner lining of any of these chambers, anything on the inside here, the layer is the endocardium. And then the muscular layer in the middle, there we go, right there, that is the myocardium. So those are my 3 layers. Okay, let's go through this heart model. Let's start with the right atrium, and we'll kind of work our way around. So here is my right atrium right here. I do see this flappy ear-like thing called the right auricle, which allows the atrium to expand a little bit if necessary. I see the superior vena cava bringing blood to the right atrium from structures that are generally above the heart. Right down here, I see the inferior vena cava bring blood back to the right atrium from structures basically below the heart. I also see the third vessel that empties into my right atrium. This bluish guy right here, that is my coronary sinus. It is the final vessel in the coronary circuit, the network of vessels that is going to feed the wall of the heart itself. Okay, if I flip my right atrium open, I do see some muscular ridges. Those are my pectinate muscles. I also see a wall here. This wall over here is the wall between the 2 atria. So it is called the interatrial septum. I see an indentation in it right there. Can I find it? There it is, right there. That is the fossa ovalis. In the fetal heart, it was a hole called the foramen ovale that let most of the blood coming into the right atrium zoom over to the left, thereby skipping the pulmonary circuit. Okay, the right atrium is going to pass blood downward into our right ventricle. Rip this off for a second here. And we've got our right ventricle right here. The hole through which blood passes is the tricuspid orifice. The valve, and we can see the valve flap right there. That valve flap is one of the 3 tricuspid valve flaps. Now, tricuspid valves, the tricuspid valve flaps have these strings attached. These strings are called chordae tendineae. They are anchored by these bulging muscles. Bulging muscles are papillary muscles. Those structures prevent the valve flaps from flipping upward, which is called prolapse, and allowing backflow. Now, if I look at this wall of the right ventricle, so right in here, these muscular ridges are called trabeculae carnii. Now, I do also see my interventricular septum right here, separating the chambers of the right and left ventricle. Now, blood from the right ventricle is going to get pumped up into this guy right here. There is the pulmonary trunk. This is the first artery of our pulmonary circuit. Pulmonary trunk comes up and is going to branch, giving me a pair of pulmonary arteries, a right and a left pulmonary artery going to the two lungs. Now, blood comes back to the heart by way of these four pulmonary veins. So we got two on the left here and then two over here on the right. Four pulmonary veins bringing oxygenated blood back to the left atrium. Now, if I open up my left atrium, if I can, there we go. I do see the fossa ovalis, there it is, where the foramen ovale once was. And if I found that fossa ovalis, I've also found the interatrial septum. Okay? All right. The valve and the opening, right, we see right here, called the mitral orifice, and the mitral valve is the actual structure. If I spin it around, let me show you one more atrial structure. That is the left auricle right there. And then I look in and I see my left ventricle. Let me jump back to the right ventricle for a second because I totally forgot to mention this guy right here, the pulmonary semilunar valve, which prevents backflow from the pulmonary trunk down into the right ventricle. Now, the left ventricle, we do have that mitral or bicuspid valve. Flaps are right there. It does have the strings. Try and get a good angle. There we go. The strings attached. Those strings are the chordae tendineae, and they are anchored to big bulging papillary muscles. Now, the left ventricle also has the trabeculae carnii, those muscular ridges right there. Blood from the left ventricle is going to be pumped up into the aorta. I see my aorta right here. And we do see there it is, the aortic semilunar valve, which prevents backflow from the aorta to the left ventricle. Now, this is my ascending aorta right in here. Coming off the ascending aorta, I do see the right coronary artery. I don't see the left coronary artery because it's covered up by my left auricle and my pulmonary trunk. Now, I do see a branch of my left coronary artery running down the heart here. This is the anterior interventricular artery. My right coronary artery gives off a branch in the back, which I see right here. There it is. That is the posterior interventricular artery. Now, I got to realize these interventricular arteries are going to give us, and all the coronary arteries are going to branch and give us smaller and smaller coronary arteries, leading to coronary capillaries that feed the wall of the heart. And then we're going to have small coronary veins, and eventually bigger and bigger coronary veins, including the great cardiac vein in the front, including there it is, the small cardiac vein on the side here, and the middle cardiac vein in the middle of the back. And all those veins empty into the good old coronary sinus, which empties into the right atrium. Okay, almost done. The ascending aorta right there comes up and becomes the aortic arch, which then curves and goes downward and becomes the descending aorta. It's been cut right here, right there, actually. There we go. Now, I want to also show you the three branches of the aortic arch. We have the brachiocephalic artery, the left common carotid artery, and the left subclavian artery. Left subclavian goes up under the left clavicle, left shoulder, left arm. The left common carotid comes up the left side of the neck, going to give you blood to your head, to your brain. The brachiocephalic actually splits. We don't see the split because it was sliced, but it splits into the right-hand version of these two. So off the brachiocephalic would be a right common carotid and a right subclavian, feeding the right head and the right arm, respectively. Okay, so close to being done. I'm gonna get rid of this model for a second. I'm gonna trade it for this one. On this model, we see one structure that wasn't too clear in the other model. Lovely structure. Can't get this right atrium to stay on, can I? The structure we see here is this little piece of connective tissue linking the pulmonary trunk and the aortic arch. That's called the ligamentum arteriosum. In the fetus, it was actually a vessel, providing another route to skip the lungs, just like the foramen ovale did. And so in the fetus, there was a vessel here called the ductus arteriosus. And then after birth, it eventually becomes this little band of connective tissue called the ligamentum arteriosum. And with that, we're done with the heart model. Thanks for watching. Bye-bye.